dear students. I'm Kalaivani, Department of Pharmacy Practice from SNS College of Pharmacy and Health Science. So today we are going to discuss about the topic Parkinson's disease. So Parkinson's disease is a central nervous disorder, and we are going to see about the definition, etiopathogenesis, clinical manifestations, and the pathophysiology of the Parkinson disease, signs and symptoms, causes, and then pharmacological and non-pharmacological management of Parkinson's disease. So let's go deeper into the study. Yeah. What is Parkinson's disease? Parkinson's disease is a neurodegenerative condition resulting from loss of dopaminergic neurons in the brain, characterized by associated motor symptoms. So what is neurodegenerative? It is a progressive, irreversible loss of neurons, and dopaminergic is nothing but dopamine producing neurons in the substantia nigra. So here, coming to the pathophysiology of the Parkinson's, motor signals generated by cerebral cortex travel along the motor pathways and producing the or provoking the movement of our body, like moving our hands, legs, walking around, etc. So here, the Parkinson's occurs due to the loss of dopamine producing neurons in the substantia nigra, where dopamine is nothing but a neurotransmitter and a hormone, and it plays a major role in many important body functions like body movement or body parts movement, memory, pleasure, reward, motivation, etc. And what is about substantia nigra? It is a small part located in the midbrain, the region of the. So basal ganglia is important in regulating the motor signaling. Okay, here we are having some of the internal parts of basal ganglia. That is, the first one is indicating the red color is caudate and putamen. It is combinedly called as striatum, and the yellow color indicates the globus pallidus, and the blue color subthalamic nucleus, and the green is substantia nigra. Okay. And here, coming to the pathophysiology of the mechanism, that is, we are having two from the motor cortex to the striatum, that is caudate and putamen, a glutamate being excited, and from the striatum to the globus pallidus and substantia nigra, a GABA aminergic will be excited, and from the globus pallidus internal to the thalamus, that is subthalamic nucleus, again the GABA have been excited, and from the thalamus to the again cortex, a glutamate will be excited. So here the movement of the body will be increased, and in the indirect, that is, it terminates. Direct pathway will facilitate the movement and indirect pathway will terminate the movement, and here also the same will be happening. That is, the indirect pathway also originates in cortex and projects to the striatum, but then travels through the external globus pallidus and subthalamic nucleus before reaching the internal globus pallidus, that is GPI or substantia nigra pars reticulata. So the direct pathway is known as excitatory, that is facilitates the movement, and the indirect pathway is called as inhibitory, which suppresses unwanted movements. Yeah, okay, I think we'll be in a clarification of the pathophysiology. Again, in substantia nigra, pars compacta, neurons affected in Parkinson's disease, and here the increased dopamine will lead to the D1 receptor, that is, which stimulates the direct pathway, and D2 receptor, which inhibits the indirect pathway. In D1 direct pathway, the dopamine gets increased, and the more activity will lead or will promotes the movement, and indirect pathway, the less dopamine, that is, the less activity promotes the movement. Here the inhibition process. Again, in direct pathway, there is a less activity which leads to less movement, and more activity leads to less movement in the indirect pathway. So this the pathophysiology of the Parkinson disease have been entered. And again, in substantia nigra, that is in the pars compacta, the alpha-synuclein, a protein deposits which leads to the death or inhibition of the neurons, that is Lewy body dementia. It is called as Lewy body dementia. Okay, fine. Then coming to the signs and symptoms of the Parkinson disease. It appears when 50% of our brain neurons have been lost or get death or damage. The first one is bradykinesia, which everyone knows that brady is about slow and kinesia is a movement, that is slow movement in our body parts or body, and a rigidity, muscle stiffness. There will be a muscle stiffness which will be called as a cogwheel. You know about the cogwheel which will get stuck and we cannot move faster or we cannot reflect for the fast reactions. It is also known as leg pipe. And the rigidity will be among not only in the arms or muscles, it will be out throughout the body. And next coming to the hypomimia. Hypomimia is nothing but express in the face. So we cannot express our reactions in the face where the persons will be looking in same in all the expressions. So the next one comes, this is the main sign which leads to tremors. What is a tremor? Tremor is nothing but, you may have noticed some of the people, that is old age peoples, will be sitting in rest. While they are resting, they'll be having the habit or something like pill rolling. It is called as pill rolling. They'll be doing like this. This is called pill rolling, and the people who's having Parkinson's will be, while resting, they'll be having the habit. It is not an intentional, it is the sign or symptom of the Parkinson disease. See, like this, they will be doing on. You have may noticed. And the next one comes Yahr disturbances. This is nothing but it is an abnormal walk. They shuffling. They can't walk normally, which leads to the imbalance, and they will be having the risk of falling. Whenever they are walking or whenever they are going out, where they'll be having some shuffling and they will get disturbed and they can fall. So 80% of the Parkinson's disease will be due to the drug induced, one thing, and the next thing is about multi-system atrophy, a brain damage, and progressive supranuclear palsy and normal pressure hydrocephalus. So shall we see about what is PSP, that is progressive supranuclear palsy, and NPH, that is normal pressure hydrocephalus. So what is progressive Yahr is a rare late onset neurological disorder that causes brain cell deterioration, impacting moment, vision, speech, and thinking. And normal pressure hydrocephalus is a rare brain disorder that occurs when too much of cerebrospinal fluid build up in the brain's ventricles. So next coming to the it is autonomic disturbance, that is hypersalivation, constipation and incontinence, and cognitive impairment. And finally, these are the symptoms of the Parkinson's disease. And causes and risk factors is, most cases are idiopathic, that is we can't judge the cause of the disease, that is specific cause were unknown. The first one is genetics, that is nearly risk in first degree relatives. If there is a first degree relative contraception, then there are 10 to 15% of cases are familial, that is autosomal dominant and autosomal recessive characters have been induced, and it causes to the Parkinson's. And the next one is environmental condition, that is rural living, exposure to industrial chemicals, and to the infectious, that is encephalitis. Mostly if encephalitis got, Parkinson's will be there. Then third one is age, as of course we need to accept this. Mean age is about 60. So 5 to 15% before 40, and about 17% people will be affected with Parkinson's after 60. And comparing male and female, the male is greater than the female. The ratio is about 1:5:1. So, what about the diagnosis? Shall we discuss about the diagnosis? Clinical diagnosis. The disease, Parkinson's disease, will be of movement disorder, society Parkinson's disease. Criteria will be following, and if the criteria have been accepted, then it was diagnosed as Parkinson's. That is bradykinesia, resting tremor, rigidity, and the next one is supportive criteria. What is the supportive criteria? There is no exclusion or red flag criteria. Clinically, it was established. Coming to the supportive criteria, it is improvement on dopaminergic medications and levodopa-induced dyskinesia. Then it is called as supportive criteria. And lower limbs only for greater than 3%, it is about no exclusion and symptoms coincide with the dopamine blocker use. So what is about red flag criteria? Rapid progression, symmetrically, and severe autonomic failure. So these are the diagnostic methods. So when even from the bradykinesia, so even from the bradykinesia or the rigidity, tremor, we can find out that the patient is with Parkinson's disease. And other than that, Movement Disorder Society Parkinson's disease and DOTS scan, radioisotope SPECT scan are also used to determine the dopaminergic signal. So in normal persons, see the dopaminergic signal will be like this, and signal in Parkinson's, you can see the difference in the patient's brain scan. And coming to the treatment purpose, so there is no cure currently, but there are some medications which are used to slow down the process or improve the symptoms of the Parkinson's. That is the progression of the irreversible neuron, that it will be slowed down. So dopamine availability within the CNS. So the available dopamine in the brain level should be maintained in a proper manner so that the Parkinson's effect will be somewhat reduced. That is, there will be a higher progression, so improvement in the symptoms of the Parkinson's. So coming to the medications which you are going, this levodopa plus carbidopa. Carbidopa is the dopamine precursor. Carbidopa is a decarboxylase inhibitor. Here, when the levodopa and carbidopa was given to a patient who is having Parkinson's, here it will be very most effective, since levodopa is converted into dopamine in the brain and carbidopa prevents early breakdown of the levodopa here. And this pramipexole and ropinirole, dopamine agonists, they are having the same capacity like they will mimic the dopamine effects. And MAO-B inhibitors, selegiline and rasagiline, prevent dopamine breakdown. COMB inhibitors, entacapone, talcopone, extend dopamine activity. And anticholinergics, they will reduce the tremors, and amantadine, they will help with the dyskinesia. So these are all said to be the pharmacological management. And coming to the non-pharmacological management of Parkinson's disease, what do you think about non-pharmacological? Which are the categories will come under the non-pharmacological categories? So like surgeries and exercise, yoga, these are the things will be coming under the non-pharmacological treatment of the Parkinson's disease. So here the dopamine levels will be increased while taking the honor of systems, that is honor of phenomenon of the drugs. Dopamine levels will be monitored under the time variations. If the symptom is of on, it is well controlled, and if the symptom is also of off, that is the dopamine levels drop to the off, then it is rigid and controlled symptoms. If the symptoms goes to, there is an orange mark, that is it is green mark, that is the on symptoms, and it is up to the low level, that is rose, then it is said to as uncontrolled symptoms. So coming to the non-pharmacological action, deep brain stimulation, that is DBS, electrodes implanted in the subthalamic nucleus, globus pallidus interna, and pallidotomy and thalamotomy, surgical destruction of small parts of the brain to reduce symptoms. Supportive therapies like physiotherapy and occupational therapy improves movement, posture, balance. Speech therapy helps with the voices issues, and diet and nutrition. High fiber diet for constipation. Exercise and yoga help maintain the mobility and flexibility of a Parkinson's person. So these are the non-pharmacological actions. So today we discuss about the definition, pathophysiology of the Parkinson's, and treatment, diagnosis, and the symptoms. So if you feel or if you come to notice the symptoms of Parkinson in any of the aged person, just please advise them to take the first of all to prefer the non-pharmacological and to the pharmacological in the severe cases. And thank you. In the next time we can see about the another disease, which will be, I hope this will be very useful for you. This was very useful for you, and thank you so much, dear friends.